Mike Matthews.
Hey, everybody. Welcome to the Athletic Potential Podcast. This is episode 22. And as a brief overview of each episode, we start each episode with a case. It's typically the last patient I treated prior to the recording of this episode. And then we go into questions from our audience and hopefully answer a lot of those questions. And then we have a general recap and overview. Also, as a just a brief intro, I was told that I don't introduce myself very well. And my name is Mike Matthews. I'm a physical therapist and strength coach, and I own and operate Athletic Potential. It's a physical therapy practice, but also a performance training facility geared in right now mainly geared towards baseball and softball athletes and volleyball athletes, occasional soccer players. But my niche is mainly throwers, overhead athletes, those type of athletes. But we do see quite a few other athletes in this facility, and seem to help out a lot of different ages as well. We see youth all the way up, even to like our aging athletes. I hate it when I say that. I'm pretty sure they hate it more than I hate it when I say that. And that is just our master class athletes that are doing things well into their 60s, 70s. And so, yeah, that's kind of generally who we work with at Athletic Potential and who I am. And so, yeah, let's jump right into the episode. Our case today is a 12-year-old who came to me with elbow pain. Now, this is a bit of more of a unique situation. Typically, when I see an athlete come in who's 12 years old with elbow pain and it was from throwing, they either have seen a doctor or have some kind of general idea of what's going on, and usually a guess. And in this case, he saw 3 different clinicians before seeing me, all fantastic, all gave him the same diagnosis, and that was Little Leaguer's elbow. Little Leaguer's elbow is basically an irritation or inflammation of the growth plate on the inside part of the elbow. And this is typically an overuse problem. And when I say overuse, I don't want people to think that this kid was out being overthrown by a coach or anything like that. In this case, he just happened to be throwing harder in a shorter period of time than normal, but really nothing out of the pitch mark guidelines or any of those guidelines you would normally see. And so kind of a scenario where it just, I think growth phase wise, and we'll go into this in a minute, but growth phase wise, timing wise, how much he was throwing before, those type of things all kind of led to this elbow pain. Now, he was effectively managed from the beginning. So turns out his coach is a physician and a good one. And so when he had started an elbow pain, he shut him down, told him not to throw, and he stopped throwing. And he took approximately about 4 weeks off of throwing a baseball. And at around the 4-week mark, he started throwing a football again because it was football season and he's quarterback. And he didn't have any pain with throwing a football unless, as he put it, unless I really, try to zing one in, is what he said. And then he still has a little bit of elbow discomfort, but otherwise has no pain in his elbow. He just started trying to throw a baseball more recently, which is about the 6 to 7 week mark, and reported he's still having a little bit of pain in the elbow. And so that's the point where he came and saw me. He was referred to me from a couple different sources to try and help manage his situation and figure out what we're going to do. And as a general overview, just to kind of help everybody, which is the reason why I feel like this case is good, is Little Leaguer's elbow is something that is difficult to treat actively. I hate to put it that way, but the idea behind this is that it's a bone injury, and bone just takes time to heal. And typically when you have these Little Leaguer syndrome, there's a shoulder version of this as well, it requires a complete shutdown period where you don't use the arm very much. And I call it the broken arm protocol. And basically what it is I tell them you have 4 to 6 weeks. This is more specific to the elbow, but you have 4 to 6 weeks, 4 to start, where you don't use your arm. It's effectively broken. I don't go as far to sling these kids, especially if they're pretty disciplined and they won't use the arm. But if they're going to use it and do other things, and they're just kids and they just can't, hold themselves back, and they're just going to go play and do whatever they want. And play doesn't mean throw; it just means play. I'll tell them they maybe need to wear a sling at least for the first little bit to just teach them not to use the arm. And so we basically give them 4 weeks off, broken arm protocol. At 4 weeks, they come back into the clinic and see me. I do some testing trying to determine the stage of the injury at this point. So if the elbow is still inflamed, then we know that we need longer. If it's not, then we know we can maybe start on some progressive things, because we know that that 4-week period took its toll in regards to strength, general activity, those type of things. We need to build that back up in the 12-year-old, and so, or in the youth athlete. And so at 4 weeks, if that seems to be relatively not irritable, then I'll go ahead and start him on some exercises specifically more for the shoulder. Again, we're talking specific to the elbow. There's a shoulder version of this Little Leaguer shoulder, that the protocol is not drastically different, but the dates change more drastically. So we're talking an additional 2 to 3 weeks off. We start with very specific exercises. The elbow, we typically go ahead and start shoulder exercises around 4 weeks, so long as that the elbow is not irritable at all. We don't use any closed chain or like putting your hands on the ground, so there's no exercises where they're putting their hands on the ground at 4 weeks. I typically like to wait for about 6 weeks for that. At this point, we're working range of motion and mobility. Now, our case in point here, he came to me at about 6 weeks from his time of stopping throwing. However, the unique part of his case is that he's been throwing a football almost the whole time after 4 weeks. So he took 4 weeks off, and the last 2 weeks he's been throwing football more heavily and doesn't seem to have any pain, which that's good news, that he's not having any pain. That's fantastic. And he waited the 4 weeks, which I think is why I'm okay with him throwing football. And mainly not necessarily I'm like not okay with it, but it's more along the lines of I feel a little bit more secure in the fact that he's not out there irritating his elbow, because he gave it a 4-week time period off and then started throwing a football, which is different arm stress and elbow stress than a baseball. And not to mention the volumes are a little bit different as well. So in his case, I gave him the advice of, look, you can continue to throw a football. I don't feel like you should throw a baseball until the end of October. So we're going to take all of it's essentially a couple months, not to date the podcast, but we are in early fall. So I'm asking him basically not to throw a baseball for the next 4 to 6 weeks, because he's going to continue to throw a football. And now he was okay with that. Dad was totally on board of waiting, and I felt like that was a good sign. And the idea was at that point in the end of October, maybe even, start him. Well, I went back and forth on this, but essentially November 1st, we'd consider starting a throwing program, and he would never stop throwing until he got back and playing and pitching in the spring, and just have a very long, very progressive ramp up all the way to the spring, which where we're at in Utah here can get pretty difficult depending on how cold and how snowy it is. So, but the idea is there's ways to do that inside and those type of things. But that's like my favorite protocol for him in regards to throwing. Now, when I first saw him here, the key thing is I do look at the elbow, I look at the shoulder, and then I look at the rest of the body. And the idea here is that he essentially had Little Leaguer's elbow for a reason, and we had to figure out what that was, because if it wasn't overuse, if he wasn't out just absolutely throwing all the time, then it's something else. And if we don't address it, then I feel like it might, come back as we start to throw more and more. And in his case, he went out through more than he normally did in a shorter time period, and I think that's what spurred it. But what I feel like is more contributing to his Little Leaguer syndrome is the fact that when I had him stand and just try and show me good posture and normal posture, he had a pretty significant postural, I don't want to say deficit. He just could not maintain good posture, and he couldn't even find normal or neutral posture in his pelvis. And so he had this big arching lower back, flattened thoracic spine, bent over, scapular way winged off and out to the side. You just kind of looked at it. You looked like a kid that was growing, and he just didn't have the support structure of muscle in his body. However, when I tested his muscle, he was normal. Like, he had great muscle strength, and basically that is a motor control problem now. He cannot use the strength that he has because he doesn't know how to use it and to control the positions in his body. And I think, and I haven't seen any video of him throwing, which is kind of one of the next phases, is to look at that. But realistically, I think one of the main reasons he's having some of this issue is he has no ability to control his core or his spine or his ribcage position, and specifically more of his shoulder blade. And so as he throws more and more, and specifically as he throws harder, he's going to create more additional arm stress in the shoulder and the elbow. And if we don't address that, I think we're going to run into some significant issues here as he starts his ramp up protocol, and probably not until it starts to get more towards the spring which unfortunately, if we see a return of this little leaguer's elbow in towards the spring, we're talking timeout of his spring season, and that is no fun for anybody involved with that. It is no fun to tell a kid that he should take time off. It's no fun to see a kid after I tell him the news, and it's no fun for the parent to hear it as well. And so the idea is at this point, I recommended that he join a training group. We've got a 12U group that's actually training with us right now. And the predominant focus of that group is actually core and anterior or pelvic stability and pelvic control. Because this group that's trained with me a little bit before, and they know the basic movements, but again, they're growing. They don't really quite understand the posture that they need to maintain. And so we're just training that. And I feel like for this player, he'll see some substantial benefits if he's able to learn and control his posture and his pelvis and keep it in the right position. So more to come on this, mainly just because, it's just getting started. We're still trying to figure out logistics. He's playing football. He's also going to start basketball. And I think that's fantastic. He's playing multiple other sports. He's a good athlete, and he's not just honed in on baseball. And I feel like he's in a good position to put himself in a good position later in life in regards to athletics. We just got to get through this part in regards to arm stress and maybe teach him to move a little bit better and integrate those movements into more of a sport. So that's our case for today. Kind of a fun case. Always nice to see those kids come in with correct diagnosis and correct treatment already. A lot of times we'll see that. It's just not the case. They'll come in having trying to throw through pain. They've been told it's a sprain, and they've just been given bad information. And so if you have a youth athlete or you are an athlete that has pain in the elbow, it's really important that you get it figured out and by a clinician who knows how to test it properly, because a misdiagnosis can cost you a lot of time. It can cost you a lot of effort, and you won't make progress unless it's correctly diagnosed. And so anyways, it's a fun case. All right, so we're going to jump into questions at this point. And our first question comes from Nathan. And he says, it seems with the travel ball circuit for baseball and softball that the athletes are playing more games and practicing less. What is your opinion or recommendation of which is better, practicing more or playing more games? Now, this is an absolutely loaded question in the fact that there's some really heavy and strong emotions on both sides of this. And I was told a couple different things, and I'll give you the both sides, kind of the both sides of the argument, and then I'll give you my opinion and what I feel like is probably where I've seen improvements with our kids. And just know that I'm a biased sample size based on my location and based on my sample size in regards to the patient population I work with. So just know that I'm a little bit biased that way, and that I may not be seeing the full picture from every angle here. So that being said, there's some research to suggest that playing more games and getting into more competition and seeing higher levels of competition, higher skill levels than you are currently at, will improve your overall skill level as a player. Now, these are wide range studies, and so meaning it's not necessarily baseball and softball. It could be anything from I think it's a soccer study, and then a lot of the stuff's based on chess. And so we know that there's some additional benefit in playing in more competition and playing more specifically competition that is better than you or better than the athlete, and making them see the next level so they know where they need to go. Now, the key distinction here is that it's the next level and they see where they need to go. Now, where they need to go usually requires work, and we're going to get into practice here in just a minute. But just also know that it is okay for a kid not to see competition that's always better than him, that some wins and some successes, and basically putting that player and that athlete in an environment where it is okay to fail. The consequences of failure are not drastic, they're relatively minor, and it's okay for that athlete to go out and actually fail so they can learn. That's a good thing. And so when you look at actual competition in games, you want to look at both. You want to look at, am I getting a healthy enough dose that a skill level is higher than my current level, and is it progressing me and helping me to advance? If it is not, and you're only playing and you're just destroying every possible team you play, I'm not sure that's the best recipe in regards to the competitive environment for improving athletic development. The other thing to look at is you do need wins. You need to, not saying like you need to manufacture wins or like, like set it up so the kids win everything just so they feel good. The idea is that they need to face and understand that winning is good, and that they need to create that competitive drive. And it's good to have some wins. And I think it's, again, to emphasize this, it's not so much that they win, it's that it's okay to fail. They need to learn it's okay to fail, meaning the consequences of the failure is not so substantial that it really deters them. And so it's putting them in environments where the consequences of failure are not very much, and it's okay, and they can get back up and go back out and compete. Now, that being said, there's a large amount of evidence suggesting that those that spend more time in skilled practice and development typically go a little bit further, and I say a little bit, it depends on the sport and or the activity. They go further in their regarded activity than those that just play games. Now, the main study I'm going to talk about here is a chess study, but I do think it definitely applies to baseball and softball, and Nathan, that's where you're coming from, is baseball and softball here. And that is, if you look at the chess, they looked at all these grandmasters in chess, and what they found was that the grandmasters, the guys, the best guys, they practiced more and they competed less. They had more time working on deep level strategies, working with mentors, coaches, those type of things. They logged more of those hours than those that those were not as high a skill level. And if you look at the other one, those that competed more, just did more, chess competitions, they typically did not score higher in regards to chess. Chess has its own ranking score, right? So it's really easy to track, those that are doing very well in chess, and then look at their habits of practice and or competition. Those that competed more in chess typically did not score or had lower scores than those that were spending more time with practice. And so that being said, extrapolate it out if you would like to baseball and softball. It is a more skill-driven sport, baseball and softball. Very specific skills: hitting, swinging, throwing, those type of things. Those are pretty specific skills. And so I think the more specific skills we get, now I'm getting into my opinion here, is the more specific skills we get, the more practice with good mentorship or coaching and feedback, the better. Now, that being said, you have to compete. There's no reason to go out and practice and never compete. But the idea is you want to go out, you want to compete and figure out where you're not very good. And then once you figured out where you're not very good, you then spend your time in practice and with coaching and with good feedback, working on those weaknesses to progress you to get to the point where that when you go back out and compete, you can compete at a higher level because you've honed in and improved your skills. So, Nathan, I don't know if I'm going to directly answer your question, because I think it's a balance of competition and practice. And I can tell you right now that I just gave this advice. This is very specific advice to a player 2 days ago. And that was this. And they were asking me the same question. They're just like, hey, we've got this opportunity to go play in 3 tournaments. Okay. And, or we can stay back here and we can do this, instructional league. And the instructional league plays scrimmages, but they actually, spend 4 days a week working on skills-based training. And he basically asked us, like, what would you do? If your son was my son, what would your recommendation be? And I didn't know enough about his son. I had no clue about his skills development. And so I said, well, one thing I would ask your coach, coaches on both sides, because if one coach is saying, no, you have to play with us, that's the way to get better, and you have another coach saying, hey, look, he's going to go to that tournament, he's going to come back the same exact player as he was before, I think he needs to stay here and work on these skills. This is a tough question, and it's a tough question to answer, but realistically, you have to make the decision based on your overall long-term goal here. And if we're looking at the travel ball circuit for baseball and softball, I kind of always ask the question to these parents. I said, hey, look, why is your child, why is your athlete, and if the athlete's there, I'll ask them specifically. Typically, I ask them both when the parent's there and then when the parent's not there, because I want to know what their true motivation is. And that is, look, what are you doing this for? Why are you in the travel ball circuit? Why are you playing, tons of baseball games? Why are you traveling all over the country? Why are you, involved in these teams? What is the overarching goal? What are you trying to do? And that question right there, the answer to that question, really will dictate whether you should just go play more games or if you should probably practice and work in more, skilled practice with good coaching. And the reason is based on the research in regards to the chess masters. You want to be a better chess player, you need to practice and then compete. If you want to be a better, if you want to go out and just compete in chess and have some fun and play in those games, then just go compete in chess. Just know you're probably sacrificing long-term development as a chess player. Remember, this is not baseball, softball, but as a chess player. If we extrapolate that same model out to baseball, softball, the answer would be you need to play a fair amount of games to know where you're at athletically, and then you need to take a part of your season to move through and improve the skills you're not that good at. And I think if that was I told this parent, I said, look, if that's, we're in the season where I think it's probably the best time to just work on things that to improve kids and to improve skills. And the main reason is because there's not a lot of people out here looking for guys at this time. Yeah, colleges are not looking right now. I mean, they've just got back from summer. Everything's just getting started. I don't feel like the college scene is like the coaches aren't out here everywhere looking around at players, and so now's the time to really get better. Knowing that the colleges are looking at guys in the spring and summer, we know that, and so I don't know if this answers your question, Nathan, but what I would first have you do, and I'll try to bring it back into maybe kind of more of an actionable steps for you. First thing I would do, I would answer the question, what do you have your kids in this for? Is it just to go play and have some fun? And, maybe not as worried about such a, athletic development path to get them into the higher levels of the sport? Or is it, they really love it, but they have a chance and they want to go play at the next level? And if that's the case, based on whatever the answer it is, then you can make your decision a little bit more, with a little more confidence. I'd also, one other thing I'd look at is, Nathan, if your kids are going on these tournaments and they're not playing very much, you really need to know the answer to that question. Because if they're going out and they're not playing a lot, I'm not sure you're getting much out of it. They're not competing, they're just not getting much time. They may need to just improve their skills and get on another team where they're going to play some more. That may be something to look at too. That was a major tangent. But answer the question, what's the long-term goal? And then based on the long-term goal, make your choice. Play more games or spend some time practicing, get better, and then go play some games. So great question, Nathan. I'm going to scratch my head and I'm going to have to look up some of the performance research on this. There's a lot more out there. There's stuff on music. Those in musicians that I did are a lot better than others, and some of it's talent, yes, but those that just go out and perform, in music, I know there's some research on this, but those that just go out and perform and play the same songs over and over again, they don't seem to improve very much. But those that really hone in on skills and those type of things, they seem to be better musicians. But I'm really quoting off the cuff, so I may come back and recant that in a later episode, but hope that helps, Nathan. All right, second question comes from John. John says, when working with youth athletes, what do you look for or hope to see in an athlete from your training or general athleticism? I have a 14-year-old son who seems to not move very well, and I want to know if this is just him growing or if I need to get him into training. Okay. I feel like there's you got a couple questions in here, John, and your question's a great question. This is a question I get all the time. I'll get a parent to come in and want to talk to me about training, and I'll talk to them, and they go like, I just feel like they can move better, and I'll say, okay, well, I need to see them move. So we can do a movement screen on them and just get a general take of how they move, and whether it's something that needs to be improved on right away, or rather just let the athlete go out and play and have some fun. Now, we're assuming a few things here. We're assuming that the athlete is active and playing, and it's not somebody who is not an athlete really and is more sedentary as a youth than as a child. If that's the case, then they need to become more active, and then you'll be able to tell a little bit more. But if they're active and they just don't seem to move very well, then yeah, let's get them screened. Let's take a look. There may be some things that we can easily do to improve the movement ability of the athlete. And we talked about this a little bit already in our Little Leaguers elbow example, and that is, this is a good little athlete, and I haven't seen him move yet, but something tells me that when he goes to move, he'll look fairly athletic, but we're going to see a lot of areas where he's losing energy, essentially. He's just not able to maintain position, and so he's having to generate more force through the arm to throw a ball. We'd see the same thing in the hips and the knees in regards to planning and cutting and moving in a different direction. So, John would I think at 14 years old, I think at this point you're going to look at, they need to be training. I can tell you right now that we have a lot of 14-year-old for our 14U programs. They're almost all of them we highly suggest they come in for training. They're in a major growth spurt phase, typically, in a growth phase, both male and female. And if they are growing, then there's advantages of teaching them the movements and starting them in weight training programs during that time period. And so I really like having our athletes being, at least they've got to be training by 14, 15. And if they don't, that's okay. They can come and train later in 16, 17, 18. I mean, that's fine. We've seen 18-year-old athletes that are on their way to college and got them training then. And just know that there's probably, we probably could have made a little bit more progress when they're in the high school years, but the idea was they started when they started. But if I had to say, 13, 14, 15, I really like it when kids train in that age, mainly just for movement training. This is something I had a conversation with a parent yesterday, and I said, he's like, well, do you do weight training for our youth athletes? I go, yes, but let me rephrase this. See, when you say weight training, are you talking about like barbell bench pressing and back squatting? He's like, well, yeah, stuff like that. And I said, okay, I want you to know that my philosophy and our philosophy here at Athletic Potential is we work movements first. We want to make sure the athlete can move well, and then we load them. Then we put weight on them. Then we have them do those workouts. Because if they can't squat, I'm not going to put weight on them and have them squat in a bad form. And so I always say it's movement training first, and then weight training and strength conditioning and power, speed, agility, plyometrics. All those things are encompassed into that, but movement training first. And so, John, I can tell you this. I definitely would say at 14 years old, let's have your athlete go get screened, have them find a good place to train, and see if we can't improve some of the movement qualities that you're seeing as a parent, maybe not be as optimal as possible. So have them looked at and evaluated. Is always a good thing. If you've got a good facility, then it's probably worth the money, whatever it costs to go do that, and get a little bit of a training program out of that. So you asked a kind of a second question, and that is, what do you look for or hope to see in an athlete from your training or general athleticism? So this is something that we've talked about and gone over quite a bit here at Athletic Potential, and that is we want our athletes to essentially leave with what we call movement competency, meaning that they walk out of here and they're going to go wherever they go. They're going to squat correctly, they're going to hinge correctly, they're going to push up correctly or push correctly, they're going to pull or row or pull up correctly, and they're going to be able to carry weight and do so with proper posturing. And they're going to go wherever they go. They're going to. I always say we're going to know an athletic potential athlete because we're going to look at him and be like, that guy's been trained and he's doing it right. And we want also all the other athletes to see that and understand that kid's moving well. And that's kind of how we generally gauge our programming and what we want to see. Now that being said, I have what are some standards, right? And I think the standards are what maybe what you're getting at here, John, is that we have some movement standards in regards to our youth athletes. And let me tell you what those are. They have to be able to do a full squat, picture goblet squat without a weight, hands up on the chest, elbows kind of locked in. I always say no air in your armpits, kind of thing. Lock up the spine, lock up the chest, and then they're going to squat, and they should be able to keep their back straight and get their elbows on the inside of their knees. That full depth, they have to be able to go all the way down, elbows to the inside of the knees, and be able to show me that they can lift their big toes off the ground. And if they can hold that position and then come back up with good form, then I feel like they've caught the strength standard, and then we can start loading them. The hinge is very similar. They have to be able to show me a hinge by putting their butt back. If you don't know what a hinge is, go to the YouTube channel, search hinge, and you'll see it. But the idea is squats are knee bend and hip flexion, so knee flexion and hip flexion at the same time, and hinges are essentially hip flexion but minimal knee flexion. And so it's more just like, it's an RDL, straight leg deadlift, whatever you want to call it. It's that. And they have to show me that they can go as far, reach back with their butt as far as they can go, take their hands, go to the inside of their knees, push their knees out with their hands and match resistance and keep their spine straight. If they can show me that position, then they're ready for a weight. So that's our movement standard for a hinge. In regards to our push, before we add any external load, they have to show me what's called a proper push-up, which means they have to start in a proper plank on hands position, straight line between from the ear, shoulder, hip, knee, ankle. It has to be a straight line. The spine has to be straight. And if they can maintain that, then they can go ahead and go to the push-up. Push-up is to go all the way down to the ground. They rest their chest on the ground and their toes on the ground, but nothing else. Arms go out to the side, so they release the push-up. So they go down, bring their arms all the way out to the side, not touching the ground, put their hands back underneath, and then push back up. I call it a proper push-up. And if they can do that without losing spinal position or any other position in the body, then they're ready for external load or some type of weight. That's typically when we start, we'd flip them around and start looking at maybe doing some dumbbell bench pressing, and maybe we're adding a weight vest to their push-ups or an instability part to the push-ups. That's our push standard. Our pull standard is that exact same thing, except they have to show me that they can do a row. And I prefer, before we add any external load, we almost start all of our rows using a suspension trainer. And the key with that is that they can basically lean back against the suspension trainer, roll all the way up to their chest, elbows don't go behind their body. They pull their shoulder blades into the correct position without any tilting forward or back. They pull them in the correct position and they go all the way back out. Now, I really like our youth athletes to be able to do that in an inverted position. So essentially their body is flat, horizontal. They're hanging from the suspension trainer or rings, and then they pull themselves up into that row position and then all the way back down. I feel like that is a good test for their pulling strength. And if they can do that, actually as a standard, I have our pro guys do that. And a lot of them have a hard time with it. And once they figure it out, we start noticing that their ability to pull, their pulling strength is a lot better. So that's our standard for the youth on that one as well. Let's see, I think I got them all. We didn't carry. They have to be able to carry essentially anywhere from between 25 to 50% of their body weight on one side for about 20 yards, turn around and come back, and they have to make it look like it's not just totally winning, right? The weight's not just pulling them straight into the ground and they're not lugging it behind them, that they're able to maintain the position nice and tall and walk with it with confidence. And if they can do that, that's a good standard in regards to the carry. And then we can kind of go to more advanced carry positions, those type of things. So John, that's a bit of a long-winded answer, what we're looking for in regards to our youth athletes, but we have standards for all the movements. Remember, our movements are squat, hinge, push, pull, and carry. If they can do those 5, okay, then we can start looking at advancing into those more weight training, using weights, dumbbells, barbells, those kind of things. But know that all of our youth athletes have to show that first before they can what we call graduate to a weight. And so far it's worked really well. The kids actually get a kick out of it. They don't really get discouraged. It's one of those things that I always worried that, a lot of kids would get it really quickly, and then you'd have some stragglers that just really struggled with it. And what we've noticed is that those that do struggle with it, they don't get discouraged. They just keep working because they see other guys doing it and they understand they really want to just get that weight. They want me to tell them, I want you to go grab 20 pounds off the rack now and let's do it. And we haven't seen too much discouragement at all. So it's been a good thing. So good question, John. All right, well, that's it. We have 2 questions today. And I appreciate everybody listening to the episode. As a general recap, kind of go over what we did. I think it was a youth episode today. We talked a lot about youth. Our case was a youth athlete with some Little Leaguer's elbow, and we talked over the protocol in regards to rest and then return to activities, and doing so in a way that promotes not only the health of the arm, but also just general athleticism, which will help with the health of the arm. We talked over some key pointers there. Nathan had a good question in regards to like travel ball, where we should be practicing more or should we be playing more games, and kind of gave you some a general framework of, hey, ask the question, what's the long-term goal of all of this? And then to be able to answer that question a little bit more with a little bit more confidence. And then John just asked a good question about our strength standards essentially for our youth athletes and what we look for and what we hope to see in all of our athletes when they're done training with us. So, hey, I appreciate everybody taking the time to listen to the podcast, and we'll catch you next time.